Hi, welcome to the New to Medicare workshop. I'm Jordan Lyons. I will be presenting today. Just to take care of a little bit of housekeeping information, there are restrooms around the corner. If you need to use the restroom during the presentation, please just go ahead and help yourself. You don't need to be excused or anything like that. Also, I want to let you know we'll take a 10-minute break about halfway through, and I thank you for turning off your cell phones during the class. So, tonight's objectives are that after this presentation, you should understand the differences between Original Medicare with a supplement and Medicare Advantage. You'll also understand when you can enroll in Medicare supplements, Medicare Advantage plans, and Medicare Part D. We also want to cover financial help, preventative benefits, and Medicare fraud. And like I said, we will take that break about halfway through. So first things first, we're going to talk about some common insurance terms that you're going to hear over and over. So I want to be sure we're all speaking the same language when we talk about these. The first one we'll talk about is premium. Now, premium is the amount of money that you pay just to have insurance coverage. So that might be money that you pay either directly to the federal government for your Medicare Part B, or it might be what you pay to a private insurance company. And those are usually monthly. Another term we're going to see a lot is deductible. And the deductible is the amount that you, the beneficiary, must pay to healthcare or drug providers before the insurance starts to cover a portion. So that's the original part that you don't pay automatically, right? But that's what you are on the hook for before the insurance kicks in. And most of those are annual, with one big exception that we'll talk about later. Finally, the other important insurance term you'll hear over and over is copayment or coinsurance. And when we say that, we're generally going to mean the portion that you, the beneficiary, are required to pay providers after you pay the deductibles. So after you've met that deductible and insurance is kicking in, you usually are still going to be on the hook for a portion. And the difference between coinsurance and copayment is that coinsurance is a percentage and copayments are dollar amounts. So you'll hear about 20% coinsurance percentage, or maybe a $5 copay. Okay, what is Medicare? Medicare is federally supported health insurance for people who are age 65 or older. Almost everybody age 65 or older has Medicare. People under the age of 65 who are on Social Security Disability Insurance, SSDI, and people with end-stage renal disease, no matter what their age is, so end-stage kidney disease. There are some things Medicare usually does not cover. Medicare does not cover dental, hearing, or vision. And it also doesn't cover long-term care needs other than rehabilitation. And we'll talk a little bit more about what that means in a moment. Okay, this chart is really important. We put it in your binder because it's something we'll talk about over and over. There are two main ways to get Medicare coverage. One is going down the left side of this chart, where you get your original Medicare Part A and Part B. Maybe you get a prescription drug plan, Part D. What a lot of people find when it comes to Medicare is that Medicare does not cover everything, and so they're going to get some additional coverage for hospital and medical. And there are two ways to do that we'll talk about today. And one is a Medicare supplement, a Medigap policy, also known as. The other one is Medicare Part C, which is also called Medicare Advantage, or sometimes just a Medicare health plan. And we will talk about why these are kind of the two divergent paths on this chart and how they're similar and how they really are different, because that's important to understand. So keep this chart in mind. We are going to look at this again and again today. Okay, let's break it down. Let's start talking about those parts of Medicare. And not surprisingly, we're going to start with Medicare Part A. So the different parts of Medicare cover different types of services. And Medicare Part A covers inpatient hospital stays. So Um, and each part of Medicare has its own scheme for premiums, deductibles, and copays. So Medicare Part A for most people has no premium. So for most people, it's $0. If your income is very high, you might have some premium with that. Or if you didn't get those 40 credits of coverage, you might have a premium. So if you or your spouse never really worked part time or full time or never really paid FICA taxes, you might have a little bit of a premium for Medicare Part A. But that's really the exception. Most people have a $0 premium for Medicare Part A. Now we're getting into what I said before, that Medicare doesn't cover everything. So here's the deductible if you become an inpatient hospital and it's covered by Part A. It's $1,316. So that's a decent chunk of change. And the thing to know about this deductible is that it's that amount once per benefit period. So you remember that I said that most of the deductibles we talked about would be annual? Well, this is your exception. This is once per benefit period, which starts when you start receiving services and it ends when you haven't received services for 60 days in a row. So if you think about it, if someone has a bad year where they're in and out of the hospital a few times, it's possible they could be on the hook for that deductible 5 or 6 times. That would be kind of a worst case scenario for Medicare Part A, but it is possible. Medicare Part A also has some co-pays. For the hospital, you get 60 days with no copay, and the deductible of Medicare is actually based on the average price of one day in the hospital. So everything in Part A is usually broken out in terms of days. So you're kind of on the hook for that first day. Then you get 60 more at $0. At days 61 through 90, it jumps up to $329 per day. A lot of times if you're well enough to go out of the hospital but not well enough to go home, you'll be discharged to a skilled nursing facility where you have 20 days at $0, then $164.50 per day. For home health, you can have no deductible or copay. Part A is also the part of Medicare that covers hospice care. So when someone has a terminal diagnosis, they can opt, instead of going for curative care, they could go into hospice, where they're getting comfort care but not aggressively trying to cure their health condition. And if you do that, you're looking at a $5 drug copayment and 5% coinsurance for respite coverage. Something I really want to make clear on these benefits. When we talk about the skilled nursing and the home health, we are talking about rehabilitating from an acute health issue. For instance, someone has a stroke and they are, receiving some temporary rehabilitation before hopefully they can go back to living independently. Or maybe someone broke a hip and they need some of that care before they can go back to living independently, perhaps. That's the kind of care Medicare Part A wants to pay for, rehabilitation. What they don't want to pay for is the kind of care where perhaps somebody has dementia and they need to live in a long-term care facility for the last few years of their life. Unfortunately, that's something Medicare doesn't cover. That would be paid for probably with long-term care insurance or with Medicaid, and that's kind of another story for another time. But it is something Missoula Aging Services can help you out with. So please feel free to give us a call if you have more questions about that. Okay, here's another really important aspect of Medicare Part A. Medicare Part A affects your Affordable Care Act coverage, or Obamacare. With Medicare Part A coverage, you don't need a plan from healthcare.gov in order to avoid that individual mandate tax penalty. If you have Part A, you're considered covered and you won't get the penalty. So you don't need to go get one of those plans if you're eligible for this part of Medicare. On the flip side, if you currently have a marketplace plan or an ACA plan, um, and you start Medicare, you want to be aware that you can keep your plan, but you will lose any premium tax credits or cost sharing that you get through the marketplace. So hanging on to that plan that you've had before and starting Medicare, that's usually going to be your most expensive option. That's going to be far more expensive than even a Cadillac plan through one of the other options we'll talk about. So for example, I put this in the healthcare.gov website. A 64-year-old making $30,000 per year can get a tax credit, so their marketplace plan would be only $109 per month. After Medicare starts, they'd have to pay their full premium of $467 per month. So pretty steep, and that's usually, for a lot of people, that's not going to be competitive with basically any other option we're going to talk about here. You want to be aware of too that you need to call and cancel your marketplace plan when you start Medicare. That's the one thing that's going to not really automatically switch over. And you also want to be aware that if you do this option where you stay on your ACA and lose that tax credit, you may still get charged that lower amount for the premium, and then get walloped with a huge tax penalty for all those months where you actually owed more. You owed more for all those months because you were kind of double dipping with Medicare and ACA. So that's just something you want to be aware of. Okay, this is another important item on Medicare Part A. Medicare Part A and employer-based health insurance. Since Part A has that $0 premium for most people, many are going to choose to take it right away, even if they already have employer-based coverage. You know, a lot of people anymore are still working when they turn 65, and they can continue to use their employer-based coverage. A lot of them are going to just grab Part A in addition to that, just a little free additional hospital insurance. But there's really something you want to be aware of with that. You cannot make pre-tax contributions to a health savings account and have Medicare at the same time. Again, you're going to get dinged with a tax penalty. You can keep the money you put in your HSA before you qualified for Medicare, and you can use that for a lot of expenses associated with Medicare. You can use it for premiums on Medicare Part B, Medicare Advantage, or a drug plan, but not a Medigap or Medicare Supplement, just something to be aware of. You can even use it for things like co-pays, deductibles, and also you can use it to purchase long-term care insurance. And like we just talked about, Medicare doesn't cover long-term care insurance. If you do have an HSA and you're currently working, you just want to weigh those pre-tax contributions against some additional hospital coverage, which is going to be the best deal for you. Deductible of $1,316 instead of maybe $5,000 for a hospital visit, or saving a little bit of tax money on the money you divert to your HSA. Something I really want to be clear on too that is very important about this is that if you put off starting Medicare Part A after your 65th birthday, and then you choose to start it a little later. Let's say 2 months after you turn 65, you start Medicare Part A. Well, it's going to go back retroactive to the month that you turned 65. So if you've been continuing to contribute to your HSA, or you've kept your ACA insurance for that extra 2 months, you could get dinged for the months that Part A and those types of insurance policies overlap. So you really want to be careful with that. And you especially want to be careful because that can go back up to 6 months. If you're within 6 months of your 65th birthday, it's going to go all the way back to that month. And that's something you really want to be aware of, right? Because maybe you put off Part A to have a few more months of that pre-tax contribution benefit, and then maybe you end up needing to take Part A because you ended up in the hospital. Maybe it wasn't really your choice, or maybe you're having to retire because of a health issue that's come up after your 65th birthday. So I would definitely tread cautiously through that. Be careful with that. And I think that's a confusing thing, and unfortunately for a lot of people, I don't think they really realize a benefit for that. I mean, I think a lot of people, to be told, hey, congratulations, you've had extra hospital coverage for the last few months you weren't even aware of. A lot of people would say, well, I haven't been to the hospital, so what good does that do me? So just a little something to be aware of there on that one. Okay, so that's Medicare Part A. Let's switch gears and talk about Medicare Part B. So Part A covered those hospital stays, inpatient hospital stays. And remember, just because you're in the hospital doesn't always mean you're a hospital inpatient. You could be covered by Part B if you're not an inpatient. Even if you spend the night in the hospital, maybe you're not an inpatient. The kind of classic example of that is a sleep study, where you spend the night in the hospital so that they could observe your sleep, but you're not exactly in the ICU, right? So you're not an inpatient in that case. So that's an important thing to find out if you're in the hospital for observation, or are you admitted as an inpatient in the hospital. Okay, so let's talk about Part B. Part B, unlike Part A, it does have premiums for most people. In 2017, the premium is $134 a month, and it goes up for people whose incomes are over $85,000 or couples over $170,000. There'll start to be some surcharges on there. Most people are just going to have this premium come right off the top of their Social Security, so they never even see it. They never even have to think about paying the premium. Part B does have a deductible also. It's $183, and that's a normal annual deductible like you're used to. And then Part B has coinsurance. After you've paid that $183 deductible, after that you're responsible for 20% of Medicare approved costs, and Medicare pays 80% on all your outpatient expenses. Now this is really important. I mean, that sounds like a pretty good deal, right? Medicare's paying 80% and you're paying 20%. But this is probably one of the areas where people have the most risk of potential downside, because there's no cap on that 20%. So, you may be paying 20% in a worst case scenario, maybe 20% of $100,000 or $200,000, right? If you had something major, like you had cancer or you needed a lot of surgeries, maybe an organ transplant. So you could be looking at $20,000, $40,000 you're on the hook for, if you're hanging out with just original Medicare Part A and Part B. So between that Part B coinsurance and the Part A deductible, I think you're starting to see why people get additional coverage in addition to original Medicare to help them with their hospital and medical expenses. Alright, so we talked about Part A and employer-based insurance. This is Part B and employer-based insurance. So Part A was, you remember, most people tend to take that. They tend to just grab it because it has no premium for them. So unless they are in one of those situations, like they have they have an HSA through their employer and they want to keep getting those last few months of contributions, everyone's going to grab Part A. Part B, people might hold off. And here's why. If you or your spouse's employer-based coverage is as good as Medicare Part B, you can use that coverage to wait and start Part B later without a penalty. So, the government doesn't want people going without health insurance until they get sick. And so to make sure that the people who are well get coverage as well as the sick people, they are going to ding people with penalties for going without coverage. Um, you can avoid that penalty if you've been on the employer-based coverage and the employer's coverage is as good as Medicare. And I've been told actually that you don't want to say creditable for Part B. Um, Creditable really refers to actually the drug coverage, but your insurance is as good as Medicare and will actually be primary for Medicare if you work at a large employer with 20 or more full-time workers. You definitely want to double check it with your plan administrator, someone in the benefits office, and double check that Medicare would be secondary to this employer-based coverage, and that that it's as good as Medicare Part B and is going to let you avoid that penalty. Your employer-based insurance, it may or may not provide better value than Medicare Part B. It's something to look at. I wouldn't assume because your employer offers it that it's better coverage. I would shop around. Another really important aspect to consider is that the you want to consider that this insurance will no longer be primary as soon as the insured person, whether it's you or your spouse, is no longer an active employee. So I had an example one time where someone was retiring on maybe like the 15th of the month, and their insurance, their employer offered to extend their insurance through the end of the month, right? And I was surprised to find out that, on Friday the 15th, the employer-based insurance was primary. On Saturday the 16th, it became secondary to Medicare. Even though it's the same policy, the same card, the same number, because that person wasn't working anymore, they'd retired, that switched over to being secondary. Employer-based coverage at a large employer is the only type of health coverage that's ever primary over Medicare. Medicare is almost always paying first, but just that active employment at a large employer. All right. When employer-based coverage ends. If you chose to do that, you chose to stick with your large employer's health plan instead of starting Medicare Part B right away, you have 8 months. When you find, let's say, a couple years later, you actually do retire. You've got 8 months to start that Part B without a penalty. So just want to be aware of that. Most people are going to want to start it right away because they want to have health coverage. They don't want to go 8 months without any medical coverage. Another kind of gotcha that you want to be aware of is even though you've got the 8 months on Part B, you only have 63 days to start drug plan or a Medicare Advantage plan. So just another thing that you want to be aware of. Okay, so that's Part A and B. How do you start Part A and B? If you're already drawing Social Security, your card will show up in the mail, and you don't have to do anything if you want to take those. You would only have to contact them if you wanted to forego a part of Medicare. You can enroll up to 3 months before your 65th birthday. You can do that online at socialsecurity.gov. You can also give them a call or go to a field office near you. But I would go ahead and try online first. That's usually going to be your quickest way to get that done. Once you do that, Medicare is going to issue you a Medicare card. Your Medicare card, it looks like this. It's a red, white, and blue card. It looks a little bit like a Social Security card. Has some important information on there. A lot of programs like the SMP program recommend against carrying your original Medicare card with you. They recommend taking a photocopy and blacking out some of the information. Your provider should accept this as a stopgap until you get them that present that original copy, and this way if your wallet is stolen or misplaced or something like that, you're not as at high of a risk of Medicare identity theft, which certainly does happen. There are a lot of sad stories about somebody needing, for instance, a wheelchair, and they go to get one, and Medicare says, "Well, wait, you already got a wheelchair," and they actually hadn't. Someone had stolen their identity with their Medicare information and filed that claim. You do, just certainly take the card. If you're on your way to the doctor's office or the hospital, you can sure take the card, but just don't keep your original card with all the info in your wallet or your purse for day in, day out. There are programs that can help you to pay for those expenses that Part A and Part B leaves you with. I highly encourage you to check that out. Here are the income and asset limits. Check this out before you look into additional coverage like we're about to talk about. See if you can get financial help from the government first. Get all the benefits you're eligible for. Okay, so as we've seen, Part A and Part B, also known as original Medicare, leaves you responsible for deductibles and co-pays or co-insurance. You can get additional coverage through private insurance products, which we're going to talk about now. And those include Medicare supplement policies, which are also called Medigaps. Sometimes people will just shorten that to MedSups. There's also Medicare Part C, which is also called Medicare Advantage, or sometimes just Medicare health plans. And each type of coverage through those products has pros and cons, and here they are. Okay, starting with Medicare supplements. So if you look back at your roadmap, that flow chart we looked at first, we're looking at someone going down the left side of it. So Medicare supplements, they'll pick up those out-of-pocket costs that Part A and Part B leaves you with. And there are 10 types of these plans, Plan A through Plan N, with varying levels of coverage. These are highly regulated by government, state governments, and the federal government, so they have to be very standard. So every company's Plan F, for instance, is standardized, and so no matter what company you're looking at, if you're looking at Plan F, you know what it's going to cover and what it might not cover. So let's take a look at the chart that just really spells out what everything covers. Okay. Here are those 10 types of plans, Plan A through Plan N. An important thing to clarify here is that there are two lettering schemes going on here, right? There's Medicare Part A that covers hospitals, Medicare Part B that covers outpatient medical. Here we're talking about Plan A, Plan B, and I wish these were called like Plan Roman numeral 1 rather than Plan A, because Plan A, as you can see, it actually isn't especially good coverage for Medicare Part A, so sometimes people will think there's some kind of connection between, Plan A and Part A, or Plan B and Part B. There is not. These are two separate lettering schemes that just happen to both use letters of the alphabet. Okay, so here's the chart. The check marks on this chart mean 100% covered. They're just check marks instead of 100% to make it a little less busy. Medicare Supplement Plan A covers the least in general. Plan F covers the most, and most of them are kind of somewhere in between, right? So Plan F, as you can see, that covers every single item on that chart. And when you get Plan F, it's kind of like you've put your healthcare on budget billing, because you're going to pay the highest premiums of anybody. But on the flip side, you never get surprised by a medical bill from the doctor's office or the hospital. You know, as long as you're paying your premium, you've got coverage for everything. The rest of these, you are going to once in a while pay something to a provider, to a hospital or to a doctor's office. Okay, so how do you shop for one of these? Before you even look at what company it's from, decide what kind of plan you're shopping for. Are you shopping for that Cadillac Plan F, or are you shopping for, maybe Plan A or Plan B that's just going to give you a little extra kind of safety net coverage? You can do that. The way I would do that is by go through each one of these items on here. Part A, coinsurance. Part B, coinsurance. Make a check mark. Maybe draw in an extra column on the right hand side, or on the left hand side. What are the benefits I need? And put a check mark next to each one that sounds important to you. And then based on that, you know what type of policy you're shopping for. If you checked every single box, Plan F. If you only checked the first 4 boxes, you're looking for Plan A. Now when you're doing this, you don't want to think about just your healthy 65-year-old self. You want to think out into the future, because of the Medigap open enrollment period, which we'll take a look at here. So there are only certain times when you have open enrollment for Medigap policy, and those are the first 6 months that you start Part B, and so that's the best time to buy a Medicare supplement, aka Medigap. The reason for that is the time when you can buy any policy on the market in your area, and you have guaranteed issue rate. And guaranteed issue rate means that you can buy any one on the market. They can't turn you down no matter your health history. So if you've had diabetes, you've had cancer, you've had a heart attack, they cannot turn you down. After that period, you can still shop, but you want to be aware that the insurance company at that time, they have the right to tell you no. They can turn you down, or they can raise premiums based on health issues. So if your plan is making you miserable, by all means shop, but just be aware you might not have that golden opportunity to get any policy you want. Okay, the premiums for these Medigap policies, they vary based on your age and the amount of coverage you get. Not surprisingly, in general, the older you are, the more expensive they're going to be. And the more that the plan covers, the more expensive the plan is going to be. They have 2 general schemes for raising premiums. Some plans are going to be based on issue age. That means the age you were when the policy was issued to you, you bought it, that's always going to be the age it's based on. More common anymore is the attained age policy, where each year you get a little older. You go from paying the 65-year-olds premium to the 66-year-olds to the 67-year-olds. The issue age policy basically means when you get to be 80, the plan that you bought at age 65, they're going to charge you the same amount as they're charging new 65-year-old customers. So those are going to tend to start higher and grow more slowly. These rates, they can be higher for people who use tobacco, even during the guaranteed issue right phase. So something to be aware of. They're going to look back, they're going to ask you about tobacco usage. Now is probably a great time to quit, save a few bucks on that Medigap premium. Okay, let's look at a premium comparison. So here are those 2 types of pricing schemes I talked about, attained age versus issue age. This assumes they both increase about 5% per year, which I talked to the Commission on Securities and Insurance. They told me that was a reasonable estimate. And see that issue age policy, there it goes. It goes up 5% each year for everyone, right? Each year, everybody's cost increases that much. If you got the attained age policy, on the other hand, it started out a lot less expensive. But it grew a lot faster because in addition to that 5% increase every year that everybody gets, you're also moving from the low 65-year-olds premium to the higher 80-year-olds premium. there's an example. This is something very important to take note of. Plan C and Plan F. Plan F traditionally has been the most popular plan because people just want that peace of mind. They just want to have the absolute maximum coverage, no surprises, right? That's changing because in 2020 there won't be any new Plan C or Plan F policies. So if you buy one between now and 2020, you can keep it. If you still really want to get into one of those plans with the first dollar coverage, you can keep it. But some things you want to be aware of. Those plans aren't going to get any new healthy 65-year-old beneficiaries. So there won't be anybody keeping those prices down because they're a healthy younger person who just wants a little peace of mind, right? Like you can picture, right? So in 2020, the youngest people with the plan are 65, but in 2025, the very youngest people with the plan are now 70. So it's going to get really skewed towards people who are older and need more health care. And a lot of people expect that those premiums are going to rise rapidly without those new beneficiaries. And I would say that's probably based on, there used to be different plans. You notice the chart doesn't include H, I, or J. Those are plans that this happened to in a previous generation. Some people still have those, but they can get a lot of good coverage through them, but they can be really expensive because new, young, 65-year-old gym rats don't join every day. Okay. If you are shopping for a Medicare supplement, a little required reading for you. They're regulated by the Commission on Securities and Insurance. There's their phone number there. The state also produces a rate guide to shop for these, and you also can check out the publication Choosing a Medigap. If you are shopping for a Medigap, I would just read that Choosing a Medigap cover to cover. It's not exactly light bedtime reading, but I promise you if you have hundreds or thousands of dollars on the line, it is fascinating. Okay, so we just went that way, right? We talked about Medigaps. We talked about Part A and Part B. Let's change gears and talk about Medicare Part C, Medicare Advantage. Okay, Medicare Advantage plans, they're not secondary insurance on top of Part A and Part B like Medigap. They really combine your Part A, Part B, and usually Part D coverage in a private insurance policy that is approved by Medicare. They provide some coverage in addition to Medicare Part A and Part B. They generally have lower premiums than Medicare supplements. And how do they give you more coverage but with lower premiums? Well, there's a trade-off, of course, right? And that is that they limit the providers you can see. They are going to give you that good coverage within their network of providers. And finally, the last thing to be aware of, they're usually not available to people with end-stage renal disease or end-stage kidney disease. They're not like a Medigap or Medicare supplement that's going to turn people away based on pre-existing conditions in general. But they do have that one limitation that they're not for people with kidney disease. All right, so they give you some coverage in addition to Part A and Part B. The big item they give you is an out-of-pocket maximum for hospital and medical. So you remember that nightmare scenario I talked about, 20% of $100,000. That's not going to happen with an Advantage plan because they'll have an out-of-pocket maximum that's maybe $5,000 or $10,000. They'll usually have a lower one in-network and a higher one outside the network. Also, they may include some dental, hearing, or vision coverage. And that's generally going to be coverage that is like, one cleaning a year or one eye exam a year. Though I have seen plans that let you add in additional dental coverage as a kind of an add-on. Finally, these may include gym memberships. I have seen that the Medicare supplements are more and more adding in the gym membership to stay competitive, but that's kind of like the classic feature of the Medicare Advantage. And I just want to give you a little word of caution that I've seen some very expensive free gym memberships in my day. So you just want to be aware that the gym membership isn't everything. It is a benefit, it can be helpful, but it's not everything, right? Medicare Advantage plans, they may have deductibles, co-insurance, or co-pays that could be or higher or lower than those in original Medicare. So, generally about as good, but not, everything may not be better just because it's a Medicare Advantage plan. Okay, so those are kind of the enhanced benefits of a Medicare Advantage plan. Here's the trade-off, right? Medicare Advantage plans limit the providers you can see. So typically, all of these plans are either preferred provider organizations, PPOs, or they're health maintenance organizations, HMOs. And what a PPO or an HMO means is, that's really what that means is that there's a limited network of providers. And they're a little different though. In a PPO, you can see providers outside the network, but you'll pay higher co-pays or co-insurance, and they'll count towards a higher maximum out of pocket. So, if you stay within the network with your PPO, maybe a hospital trip is $100 a day, and a doctor visit is $30 a day, and that's all going towards a maximum out of pocket of $5,000. If you start going outside the network, maybe the hospital's now $200 a day. Maybe that doctor visits $75 instead of $30. And those aren't going towards that $5,000 maximum out of pocket. Maybe they're going towards a $10,000 maximum out of pocket. An HMO is going to have lower premiums than a PPO usually, but it's also usually going to be even more strict than a PPO, because in that HMO, if you step outside the provider network, it's like having no health insurance at all. So, when you enroll in one of these plans, it is so important to make sure that your doctors who you like to see are in the network. Also, if you need to go to a new type of provider who you've never seen before, maybe you need to go to a podiatrist and you've never seen one before, you don't want to look someone up in the yellow pages. You want to look in the provider directory. That is like your Bible to find providers who are going to accept payment from this plan and give you that lower rate. Alright, so enrolling in one of these. The best way to do this is to compare your Medicare Advantage choices at Medicare.gov, or you can call Missoula Aging Services for help. It's very important that you shop each year during open enrollment, October 15th to December 7th, even if you like your plan. Because these are not like those Medigap plans where you kind of locked it in, you kind of set it and forget it. And these are, the policy that was written for you that you're agreeing to, that expires on December 31st. And if you don't shop, then next year you are going to get a plan. You might get a plan with the same name automatically, but everything you like about it, like the network of providers and the co-pays, might all be different. So very important to shop each year, even if you like your plan. One way you can see these plans are so different is, with the Medicare supplement, you keep showing your red, white, and blue Medicare card at the doctor's office and the hospital. It's different with the Medicare Advantage plan. You want to show plan's card and not your Medicare card in this case. Finally, this is very important. Within a year of joining a Medicare Advantage plan, you get one more chance to have guaranteed issue right for a Medicare supplement. So, you want to put that date on your calendar, right? Write down your last chance to check in with yourself about would you rather go with a Medicare supplement, probably for the rest of your life. Um, and then, don't be that healthy 65-year-old who doesn't even go in for a doctor visit. At least go to your new to Medicare visit. At least, check out the plan, um, have things done you need to have done, and find out if you're liking the customer service, if that plan is doing it for you. Because if not, it's your very last chance to get a Medicare supplement. Okay, so here's just a recap of what we talked about, right? Medicare supplements versus Medicare Advantage. The supplement is guaranteed renewable. As long as you keep paying the premium, you've still got the policy. But on the flip side of that, it has the limited guaranteed issue right. The Medicare Advantage plan, that one you shop for every year, for better or for worse. If you don't like your plan, at least you're only stuck with it for the rest of the year. If your plan was perfect, next year it may not be available and you've got to find the next best thing. The Medicare supplement, you go anywhere Medicare is accepted. With a Medicare Advantage plan, you have the limited provider networks like an HMO or a PPO, or there's some even more exotic types of plans. A Medicare supplement will possibly cover all the deductibles and copays like a Plan F, although you want to be cautious about 2020, right? The Medicare Advantage plan, on the other hand, has a maximum out-of-pocket. They're going to let you pay copays and coinsurance until you hit that maximum out-of-pocket. Medicare supplement, for all that coverage and all that flexibility to go everywhere, the trade-off is higher premiums. The Medicare Advantage, it's limiting where you can go, and you're going to pay as you go, but you get the lower premiums. So those are kind of some of the trade-offs of going one way or the other on this. Okay, let's take a break. All right, so now we're going to talk about Medicare Part D, Medicare drug coverage. So, people like to say Part D is easy to remember because D stands for drugs. I go with something a little bit different. I say that D stands for different, because shopping for Part D is not like shopping for other types of insurance. And I'm going to show you why. Like Medicare Advantage plans, Medicare Part D plans are run by private companies. The beneficiaries shop every year during open enrollment, and the plans have networks of pharmacies. Okay, so far that doesn't sound that different, right? But shopping for Part D is different than shopping for other types of insurance. And here's why. The way that you shop for one of these plans is you make a list of your prescriptions in your preferred pharmacies to estimate the cost of each plan, and then you do a matchmaking process of matching your list of prescriptions with the best plan for you. You really want to do that process and not try some other way to figure out the plans, because the plans are so dang complicated to figure out, and we'll see that. And one of the reasons why is because they have these coverage levels. Okay, shopping for Part D plans. There's one best way to do that shopping matchmaking process I mentioned, and that is to use Medicare.gov's Plan Finder and the list of your prescriptions. Just like Medicare Advantage, open enrollment is from October 15th to December 7th each year. You should shop for a Part D plan or a Medicare Advantage plan with drug coverage each year during open enrollment, even if you have a Medicare supplement. Just because you set that one up for life, you still got to shop every year for the drug coverage. And then you also should shop each year, even if you like your current Part D plan. Okay, let's take a look at those coverage levels. Let's start on the left. You remember we talked about Medicare Part B and how it works. It has a deductible, right, of $183. And then once you've hit the deductible, Medicare pays 80% and you pay 20% coinsurance. So far so good, right? It can get really expensive, but it's simple to understand, right? So there you have it. Medicare Part D is different. Medicare Part D can have a deductible depending on which plan you choose, between $0 and $400. Then you're up into the initial coverage level. In that level, you're going to pay about 25% for your drugs, and your plan pays about 75%. And so far, not too different from Part B, right? 75 and 25. Now it gets weird here at $3,700. Now, if your drugs over the course of the year cost $3,700, probably about 25% paid by you and about 75% by the plan, now you're into the donut hole. And this is where stuff gets really weird. You are going to start paying a lot more for your prescriptions. You're going to pay 40% for your brand name drugs and 51% for the generics. So a lot more than that 25% from before. I will tell you that even though you're paying 51% for the generics, and that's higher than 40%, the 40% for the brand name drugs is the real killer. Because you might be paying 51% for a $10 prescription, $5.10, but you might be paying 40% for a $300 prescription, $120. So that's where things start to get really expensive. If your prescriptions are so expensive that they hit $7,425, at that point you only pay 5%. Medicare pays the other 95%. So this is why, and the other factor that makes this so complicated, it's a lot more complicated than Part B, you can see. The other factor that makes it so complicated is that depending on which plan you chose, you might be paying 25% of $100 or 25% of $150. So that's going to affect when you go into the donut hole. So it can get really, really complicated, and you really need to get onto Medicare.gov to shop for these plans rather than, trying to figure it out with paper and pencil or something like that. That is just not going to work for you. Here's that same chart. Here's that same information shown with real drugs, though, that I put into Plan Finder and over the course of a year. And this is the part where people's jaws really drop because this person is paying so much each month on prescriptions. I will tell you that I deliberately chose a bad plan for this person so that I could show you all the coverage levels. But sometimes people have a plan this bad where maybe they chose a plan that was had the TV ad that caught their attention. So they signed up for that rather than doing this kind of matchmaking process, and they ended up with something that was way, way more expensive than it needed to be, and they could have done a lot better. Okay. The Medicare Part D penalty, just like with any other kind of insurance, they want to get a mixture of a few sick people who need a lot of services and a lot of people who just want a little peace of mind, right? So the way they enforce that is by imposing a penalty on people who skip out on the drug coverage. So if you go 63 days or more without drug coverage, you get a penalty, and it's about 1% of the average Part D premium for each month you went without coverage is tacked onto your premium. That can increase each year, so your penalty amount may also increase each year. So here's an example. Mrs. Martin, she went without coverage, so 1% for every month, 1% of the average, so 34.1 cents, so it went to $10.57. They round it to the 10 cent, so 10.60. 10.60 per month gets tacked onto her monthly. That as monthly penalty gets tacked onto her premium, and who knows, next year maybe it's 10.70 instead of 10.60 because it will tend to creep up a little bit. So especially for those of you who don't take many drugs, or maybe you don't even take any drugs at all, you want to really price this in if you're thinking about skipping out on that Part D coverage. Okay, This is another really important thing. There's financial help available for your drug coverage. So definitely do not forego coverage if you are eligible for financial help. And these are the limits. Extra help with Medicare is easy to apply for. It covers premiums, deductibles, and copays. There's also Big Sky RX, that's Montana's state pharmaceutical assistance program. That has an even higher limit and no asset limit. So if you're living off that nest egg, but you have kind of low cash flow, that can be a really good benefit for you. Choose a Part D plan carefully. So here are the common mistakes that we see all the time with Medicare Part D. The first one, not reviewing your plan every year during open enrollment, even if you like your current plan. The second one, choosing a plan without using the plan finder tool at medicare.gov. So these are some other ways people choose plans that are just really not good, and those are choosing the same plan as your spouse. There's no family plan, right? Choosing the plan based on name recognition. You want to look at the coverage before you look at the brand name. And then choosing, lumping it in with the one that your Medigap or your Advantage plan came through. It's not, it's not like bundling home and auto insurance or something like that. That last one is not signing up because you don't think you need a plan and getting dinged with that penalty. And again, especially sad for someone who could have gotten financial help with that. This is the Medicare website that we will look at in part 2. This is the place where you want to shop for Medicare Advantage and Medicare drug plans. Also has some good resources for Medigaps, which we'll look at. Enrollment periods. Here are the enrollment periods this is for Medicare Part B. Anytime in that 3 months before you turn 65, you can expect coverage to start the first day of the month you turn 65. If you wait until that month, coverage will start the next month, and as you go further out, your coverage is going to start further out. Notice that after 3 months after, you're out of that initial enrollment period, and you have to have a special enrollment period like retiring and losing your employer-based coverage. If you're within this period and you are retiring, let's say you're retiring at 65 years old and 2 months, you may think you're within that 8-month period, so coverage will start the following month. No, unfortunately, the initial enrollment period supersedes the special enrollment period, so you're going to get pushed out there to 5 months after your 65th birthday, and you may have a gap in coverage. You may need to COBRA that employer-based insurance or something like that. Okay, that review of that Medigap open enrollment period, first 6 months after you're age 65 and you have Medicare Part B. In some states, like in Montana, Medigaps are also available to people on SSDI who are under 65. You get that one more chance if you did the Medicare Advantage plan. You have that one more chance if that didn't work out for you. And the plan you get is guaranteed renewable. Most people are going to keep on with that same plan indefinitely. When it comes to Medicare Advantage and Medicare Part D, those you're going to want to shop each year, October 15th to December 7th. How to get help. You can call Missoula Aging Services if you need help with these programs, 728-7682. If you see some national coverage, they might say talk to your local SHIP program, State Health Insurance Assistance Program. And if you live in Missoula, that is Missoula Aging Services. Montana SMP, Montana has a senior Medicare patrol. Those are the folks who will help you to understand your benefits, understand your Medicare summary notices, and they can help to detect Medicare waste, fraud, and abuse. It helps you and it helps the whole system to stay on top of that. So if something isn't looking right, please just get in touch and we'll get you going with the SMP program. Okay, mail you get about Medicare. Most people, when they reach age 65, start getting tons and tons of junk mail about Medicare. And, some of it is legit, some of it might be perfectly legal, legitimate, but very salesy, and others of it may um, be just a downright scam. So it's very important to see who is the mail coming from, right? Does it come from the Centers for Medicare and Medicaid Services, Social Security Administration, the Department of Public Health and Human Services, or Big Sky RX? Those are official government accounts. If you see this logo on the mail, it's official government business, and that is something you should definitely open. You also want to open anything you get from an insurance company you're doing business with, right? But you just want to be aware that you're also going to get a lot of very official looking things that are just sales pitches. Preventive services. Medicare now offers preventive services. They've taken away that first dollar coverage. They kind of have replaced that with the preventive services that are covered with no copay. So that's something you definitely want to take advantage of. Be aware that they allow certain things for those preventative services. So if you venture off the script, you may incur a copay. You may be into now an outpatient doctor visit, which is not to say don't do that, but just be aware that if you go beyond the prescribed preventive visit that we have the handout about, you may get deductibles and copays for that. For Medicare, the New to Medicare Workshop Part 2, we're going to take a look at the Plan Finder. You can take a look at that drug list in your binder, and please fill that out with any drugs you take. And you can also just throw your drugs in your pill bottles or your last month's empty pill bottles in a bag and bring those in. That's totally fine too. And be sure, if you have it, please bring your Medicare card. If you bring those things, you may be able to get all signed up and be all squared away on that night. So kind of a nice thing for you. Okay, well, hey, thank you so much, and we will see you for part 2.